Hello, in this video we're going to be preparing for Lab 1 this week, which is going to cover both anatomical terms and the microscope labs. To begin with right here, exercise 1 begins with the anatomical terms and the architectural plan of the human body. You can find this exercise beginning on page 1.1 in your lab manual. So to begin with, we're starting with the language of anatomy, lots of terminology that may be new to you, so it's important to know that point of reference here is that the body is always in anatomical position, with the body standing upright or erect, feet slightly apart, and the palms facing forward with the thumbs pointed away from the body. Make sure that you're aware that you're responsible for all the material covered in the lab that pertains to these textbooks. As a point of reference, you can use Atlas A in your textbook to help you with visual images and then some extra information that might assist with your understanding of material from the lab. You will be learning these terms and how to identify different regions of the body using a few different methods. You'll be studying using models, which are in the lab. There are 3 different types of models that you'll see, so make sure that you're familiar with these structures on all of the models. And you'll also be referencing some of these points on yourself and your lab partners when appropriate. So stay active and stay engaged in the lab today. Be practicing the material verbally as well as writing it down as much as possible, and make sure that you have images from the textbook in front of you at all times to assist you. To begin with, on page 1.1, you're going to see a list of directional terms. A&P is going to feel a little bit like a language course here at the very beginning because we begin to supplement these terms to describe many things that you would already be using other terminology to describe. As you run down this list of directional terms, you'll see that many of the terms are in pairs. So for example, the words anterior and ventral often reference the same thing, so meaning towards the front or towards the front of the body, depending on whether you're a biped like humans or a quadruped like a dog. Posterior and dorsal also very similar, meaning towards the back or the spine. Below that is superior and inferior. These are antagonistic or opposing terms. Superior means above something, right, or towards the top. And then, of course, inferior means below. The term rostral here is unique because it means towards the nose, and so we couple that oftentimes with the word cephalic, usually used in similar contexts towards the head or the superior end of the body. Opposing those would be caudal, which is towards the tail or toward the inferior end. If you have a midline running down through the body, we use the word medial to describe anything running towards that midline or median plane, while lateral opposes that and runs away. Intermediate is a term that describes something that's located between 2 structures. Now, as we move to the next 2 terms, these get a little bit confusing. They are the words proximal and distal. We do use these to describe structures associated with the upper and the lower limbs because they're associated with the point of attachment. So with the upper limb, you have the shoulder as the point of attachment. The lower limb has the hip as the point of attachment. Proximal is anything that's closer to that point of attachment, while distal is anything further away. So for example, if we're talking about the upper limb, we would say your elbow is proximal to the wrist. Likewise, if we're describing the word distal or using the word distal, we would say the wrist is distal to the elbow. So again, using those for limbs primarily, not for other regions of the body. Ipsilateral and contralateral also go together. Ipsilateral means 2 structures that are on the same side of the body, while contralateral are structures on opposing or opposite sides of the body. Finally, you see the terms superficial and deep. If you imagine the body is like an onion with many, many layers, superficial are going to be those tissues or structures that are closer to the body's surface, like the outer layers of an onion. And then deep is anything farther from the body's surface, so more towards the core. We will often ask you to use these terms when you are comparing 2 structures, like I gave you an example of earlier. This example that's from your lab manual says the nose is blank to the mouth. And if this question shows up on a quiz or on a lab practical, we'd ask you to fill in that blank. So here you can see there's actually 2 possible answers, superior or cranial, making this a true statement. And so you may run into that. So make sure you're very comfortable with the use of these directional terms and ask us if you have any questions through the lab. The next topic you'll see are body planes. So these are defining linear relationships between body regions, and you'll see them oftentimes used during dissection, indicating where an incision should be made, or even through medical imagery. So MRI, CT scans usually run within planes that you see here. To begin with, you have sagittal planes. So sagittal planes are those that divide right from left. In your lab manual, you'll see them in 2 categories. A mid-sagittal or a median plane is one that's right through the middle. So what you would see visualized here here. And then a parasagittal plane is any sagittal plane that's dividing right from left, but doing so unequally. As you look at the frontal or the coronal plane, that's dividing anterior from posterior. And then, of course, you can see the transverse or the horizontal plane dividing superior from inferior. Oblique planes, not pictured here, run at an angle. The next topic you'll cover is that of body regions. You'll find that as we name muscles, bones, nerves, blood vessels, we'll often utilize the terms that you see here to describe the locations of those structures. So here, as you begin to learn the terms associated with body regions, you're laying a foundation for more complex anatomy that we'll be covering during this semester and next semester. So you'll see in the lab manual, beginning on page 1.2, that we divide these into regions of the head and the neck. So cephalic here indicating the whole head. This would be a larger region. And as you look in your lab manual, you'll see we give you also some smaller structures that are associated with the cephalic region. So frontal, orbital, nasal, oral, mental, all describing very specific regions. What I would recommend that you do is be able to identify the locations of the body regions listed in your lab manual using an image. And so here I've begun to list out in this PowerPoint all of those body regions that are from your lab manual. You can use your textbook to do this, right? Or you could just find a picture of a body that doesn't have labels or demarcations on it and try to apply it there. On quizzes and on practicals, we will assess your knowledge of body regions by setting out models in the lab that you'll have to study in your lab period this week. On those models, we'll set a pointer or we'll put a label on a particular region, like I would place one right here at this crease within the elbow. And I would give you a question that would say, identify the body region here or the tip of the pointer. And so I would ask you to do so very specifically. So if I have a pointer at this region, you'd be telling me that this is the antecubital region of the body. Now, what's also important here is that you be able to identify right versus left. This is essential. Whenever you're identifying right and left on a human body, you always refer to this body's right or left, not your own. So this individual here, this would be his left hand, and this is his right hand. So to make that a complete answer, if I ask you to identify this body region, you would tell me that this is the left antecubital region right here. Now, of course, if you're looking at the body from a posterior region, it's important to make sure you rotate that. So while you can't see antecubital here, we could take a look at the olecramal region, the back of the elbow. And so pointing here, I would ask you to identify this as the left olecramal region. So make sure you're practicing right and left as you move through this list of body regions. When appropriate, try to identify them on yourself or on your lab partners, and make sure you're reading the descriptions in the lab manual so you can tell the difference between regions that seem very similar visually. So of course, the list that you'll go through are those associated with the head and the neck, the torso and the abdomen, the upper limbs, and the lower limbs. After that, you'll move into looking at body cavities. So body cavities are what we think of as potential spaces, sometimes not filled with something, but just with the potential to be filled with something. And they're usually bordered by bones, muscles, or other soft membranes. Again, use your textbook and the images there, along with the torso models present in lab to identify each of the body cavities listed in your lab manual. You can see these beginning on page 1.3. We've given you twine and pipe cleaners in the labs to help you point out some of these cavities. So not only knowing the cavities is important, but also knowing the contents of each cavity as mentioned. So of course we give you a pretty basic description of things that are located within each one of these cavities. We're not asking you to research beyond that and learn more than what's written in the lab manual. But of course, if you provide us with information that is accurate, that's not in the lab manual, we'll know how to identify that. One other thing to keep in mind is that some organs may be housed in more than one cavity. So let's show an example of what this looks like. In your lab manual, you're going to see a division between cavities in the skull as well as the dorsal cavity and the ventral cavity. So I've given you the text here from your lab manual, and I show you this image that comes from your textbook. So what we're going to focus on right now is the fact that the dorsal cavity right here runs all from the brain or encompasses the brain and then runs down here the back to encompass the spine. So while in all it's referred to as the dorsal cavity, it's also subdivided into the cranial cavity and the vertebral cavity. So not only would I want you to know how to identify each one of those cavities, but I'd want you to be able to tell me the organs in those cavities. So on a model, I could put a pointer here and I could ask you to identify the cavity at the tip of the pointer. Now, of course, you could give me two answers. You could tell me that it is the cranial cavity as well as the dorsal cavity. The other kind of question that I could ask you is the following. The brain is found in which body cavities? Now, to answer that question, you need to make sure you do it the same way. Tell me the cranial cavity, which you see here, as well as the larger dorsal cavity. My recommendation is that you always start with the smallest cavity and build from there. As you look at the ventral body cavity, as is listed right here and on page 1.3 in your lab manual, that here is at the front of the body, and it's broken into the thoracic cavity, which is divided using the diaphragm from the abdominal and the pelvic cavities below. If we take a closer look at this thoracic cavity, you see that it is also further subdivided into a pericardial cavity that's central, and then the pleural cavities on either side. Now keep in mind, since the pleural cavities are duplicated on the right and the left, it's important that you know how to identify them as right versus left. So this would be the right pleural cavity, and this is the left pleural cavity. In keeping with context here, you want to pay attention to organs that are contained within each one of these cavities. So this right pleural cavity would house the right lung, and the pericardial cavity would house the heart. Now, one thing they show here with this bracket is what's known as the mediastinum. The mediastinum is almost like somebody's taken an apple core and they've carved out or bordered out the contents that run vertically here through the base of the skull and down containing the pericardial cavity. And so in the lab manual, you'll see that that includes things such as the thyroid gland, the thymus, the trachea, the esophagus, and the heart. And so once again, you run into some tricky territory here. If I ask you to tell me all cavities that contain the heart, and you start small, that could be first the pericardial cavity, then the mediastinum, then the thoracic cavity, followed by the anterior cavity. So the ventral cavity. So practice naming these structures and incorporating right and left as where needed as you go through the lab today. As you continue on through the lab manual, you're going to see that we also discuss body quadrants. So these are going to be quadrants which are formed as two perpendicular lines run through the umbilicus or the belly button. And these, of course, are going to be named according to location, both up and low. So upper quadrants across here, and then lower quadrants below the belly button, as well as right versus left. So make sure that you can identify right, left according to true anatomical position. We will provide pieces of twine in the lab, so we highly recommend that you tape these pieces of twine onto the torso models that you see on the lab benches to visualize locations of quadrant divisions before trying to name them. The final piece of the puzzle is that you should be able to identify the quadrants on the models and know the organs that are found in each quadrant. And so we've listed the names of the organs located in each quadrant on page 1.4 of your lab manual. And then, of course, you have a little visual reference here to help you. So the ultimate goal is to practice naming the quadrants and the organs while you have twine on the models, and then remove the twine from the models. On a quiz or on a practical, the twine will not be present. You'll have to know where the divisions for each quadrant exist on their own. This becomes a little more complicated when you move into abdominopelvic regions. So here, instead of just two intersecting lines, you're going to see these two two midclavicular lines that run vertically through the abdomen, as well as a subcostal line running horizontally and an intertubercular line running horizontally down here, creating 9 different regions throughout the body. So first off, with your torso models, you'd want to use your twine to actually demarcate these regions. So take twine and masking tape and find these 4 lines. The midclavicular lines are so named because if they were to continue superiorly, they would run through the midpoint of the clavicle. So that's a good point right there to base these off of. The subcostal line, which you see right over here, is going to run from right to left, and it runs at about the level of the 10th rib and where it connects to the sternum, and the cartilage that runs from that rib to the sternum. And then below that, you see the intertubercular line, and that's going to run through what's known as the anterior superior iliac spine of your pelvis. Really, this is kind of where the pockets on your genes would sit right there, so the intertubercular line. One thing that's different here between the 9 abdominopelvic regions and the quadrants is although we'll ask you to name these regions, right, we will not be asking you to identify the organs found in each one. So once again, go ahead and create the twine tic-tac-toe grid in lab. Name each of the regions, including right versus left, and then be sure to take the twine and the tape off and try to identify those regions without those being present. Running down the center here, you'd see the epigastric regions, the umbilical region, and the hypogastric region. And on either side of the epigastric, you'd see the right and the left hypochondriac regions. On either side of the umbilical, you'd see the right and the left lumbar regions. And then here on either side of the hypogastric, you'd see the right and the left inguinal regions, also known as the iliac regions. When you wrap up your anatomical terminology lab, you're then going to move right into the microscope lab, which is exercise 2. We're going to be covering a lot of the material for this exercise in lab, but you can begin by actually studying the structure here of the microscope. When you get your microscopes from the cabinets in labs, you're going to do so with both hands, setting them very gently on the table, and you're going to remove a dust cover that sits on top of each microscope. Do not plug the microscopes in and begin to use them unless directed by your instructor, but you may go ahead and begin to identify each of these labeled components. We're going to move beyond just naming the parts of the microscope to actually using all of them in class. So I would recommend reading the protocol found on page 2.2 of your lab manual before you get to class today. On the quiz, you will be tasked with knowing how to identify the parts of the microscope, as well as how to identify what's known as total magnification of the objective lenses pictured here. Your instructors will discuss this with you in class, but you can read ahead in preparation for that. We look forward to seeing you this week and hope that we can help you with any questions you have ahead of time.